All right, well, how about a whiter, brighter smile? Sounds good to me. And here with the details on how you can get that $1 million smile is Dr. Nicole Dahlkemper. How are you, Dr. Dahlkemper?
I'm doing well. How are you doing?
It's good to have you here. And a lot of people out there, they're saying, I would love to get teeth whitening, but A, I don't know what I should do, and B, I don't know if I'm even a candidate. So first, let's talk about the difference between over-the-counter and if I'm coming into the office and getting my teeth whitening.
Okay. First of all, over the counter, there's a lot of different products that you can use. There are toothpastes and mouth rinses that you've probably heard of before, and those are good for getting rid of minor stain.
Okay.
You know, you can rinse with it. It has something called silica, which is like an abrasive, and it gets off coffee stains and, you know, just minor stains.
Yeah.
So those are mildly effective. They help out a little bit. And over-the-counter products, you've heard of Crest White Strips. There's the paint-on gels. There's like whitening pens.
Okay.
I mean, if you go in any aisle in a grocery store, you can find a lot of different products.
Plenty of them.
It's confusing.
Well, I would say so, but for those of us that work this morning shift, I mean, we live on coffee, everybody except Dave Williams, of course. But what would you say for those stains that have been there for years? I mean, we've gone to the dentist, we've done what we need to do, but still those are some of those hard stains that you can't get off. Would that be someone that's a candidate to come into the office and get?
Yeah, someone who has a lot of stains, who drink coffee, red wine, anything like that would be a good candidate for in-office whitening.
Okay.
Over-the-counter products can give you a few shades whiter.
Okay.
I guess the benefits of over-the-counter, they're easy to get and they're cheaper.
Right.
However, the over-the-counter products, it can't get in between the cracks of your teeth, and it also, some of the Crest White Strips only get like your front 6 teeth. So it's not getting the teeth. So when you smile, most people show more than the first, you know, the 6 teeth in your mouth. So the rest of your teeth will look a little bit darker, and it takes a lot of time. It takes maybe even 14 hours total, over 14 hours total time, because you have to use it for 2 weeks. You use it an hour a day for 2 weeks, and you have to be consistent. And these are the over-the-counter products, and you might not even get the results that you want, so it might not be worth your time.
Right. So I guess if somebody does come into your office and they want to get whitening or something like that, maybe who's a proper candidate?
Patients that have crowns and veneers, those will not whiten, or big fillings or bonding on the front teeth. Those will not whiten with any kind of whitening product.
Okay.
But, you know, people who drink, like I said, red wine or coffee and get stains every day, I mean, those candidates are good candidates for whitening.
You wanted to touch on the light that you use to brighten someone's smile. What does that mean? Some
patients use, or some doctors use Zoom in-office whitening. We do not use the light because research has shown that it really doesn't whiten teeth more. It actually can cause more sensitivity, and it can also just cause more pain for patients on eating and drinking, and it really doesn't get them whiter. So we use something in-office whitening. It's called opalescence. It's a booster, and it's a one-hour office treatment. What we do is we put a barrier over the gums, because I'm sure many people who have tried whitening at home have actually burned their gums before. So what we use is very strong, and it actually will get in the cracks and grooves of the teeth and whiten 5 shades or more.
Okay, so we just want to make sure that if you do want to go in, maybe just go in for a consultation, ask you if I'm a proper candidate or something like that. Don't just think that I can just go keep whitening my teeth over the counter and think that it's going to be okay. Yeah,
because people can actually do a lot of damage. When you take the dental professional out of whitening, you're not getting your exams, you don't know if you have other issues, and also there's a lot of misuse of over-the-counter whitening products causing damage to the gums, to the teeth as well.
Okay, well, very quickly, let's look at some before and afters while you tell us where you're located at, and look at how amazing that is. It's like the difference between night and day. No pun intended, but seriously. I mean, that's amazing. And this was how many treatments? Can you just do this in one visit?
That was one office, yeah, one office treatment. It was just 1 hour. So, I mean, it's really great because you get the results that you want in only an hour. Depending on what your habits are, if you're drinking coffee
every day,
then
6 cups.
6 cups. I don't know.
What does that mean? Stop laughing at me and judging everyone in here.
After the whitening, you do want to avoid coffee for at least 24 hours because the whitening makes your teeth more porous. So if you're whitening and then you're drinking coffee right afterwards, then that's not really a
So I need to come in on a Friday, that way I don't have to drink my coffee on Saturday and Sunday.
Exactly. But when we do the in-office whitening, what we do is we make custom trays for patients as well.
Cool.
So that's good for maintenance. Meaning after you come in every 4 to 6 months for your cleaning, that's a perfect time because all the stains off your teeth to do like a booster. What I mean by that is, we'll give you professional whitening gel that you can just use for maybe 2 or 3 days.
Okay.
And it'll give you that boost after the in-office whitening.
Awesome. Well, the website is watersedgefamilydentistry.com. You see it right there on your screen. There's the phone number and where you can find them at right there in Mount Pleasant, so a convenient location.
Yep, we're right off the Isle of Palms connector across from the DMV.
Great. Well, thank you so very much for being with us this morning. We really do appreciate it.
Well, thank you for having me, Laura.
More information on Dr. Dahl Kimmer you can find on our website at abcnews4.com. Click on the Low Country Live tab. All right.